PrimaFit external urine management system for the female anatomy acts as a transition from indwelling catheters to independent continence by promoting early catheter removal or avoidance of indwelling catheters for the female anatomy. It's designed to address three key factors required to effectively manage urinary incontinence: fit, securement, and performance. Before placement, follow your facility's protocol for setting up a suction canister and tubing. Place your patient in the supine position and separate the legs. Clean the patient's genital area from front to back, following your facility's protocol, and assess the patient's skin integrity. Attach suction tubing and ensure connection to device is secure. Position the device vertically, with the soft tapered end facing down and the white fabric facing the patient's labia. Align the soft tapered end with the perineum and place the device between the labia and against the urethral opening.
Check to make sure the absorbent fabric is covering the urethral meatus.
Curve the device toward the patient's lower abdomen. While holding the device in place, remove the adhesive liner and smoothly adhere the adhesive pad over the suprapubic region. Set vacuum to low, continuous suction at a minimum of 60 millimeters of mercury. Return the patient's legs to a naturally closed position. When properly positioned, PrimaFit diverts urine away from the patient's skin and into the system's core. The urine is then suctioned from the tapered end into a collection canister. Replace the device every 12 hours or if soiled with stool or bodily fluids other than urine. To remove the device, place the patient in the supine position and separate the patient's legs. Gently remove the adhesive pad. Separate the labia and remove the device. Assess the skin integrity and perform perineal care per facility protocol. Disconnect and discard per hospital protocol and local regulations. To learn more about PrimaFit, call or visit our website.